There are 6 vital signs: pain, respirations, oxygen saturation, temperature, blood pressure, and heart rate. When assessing your patient's pain scale, you should use a verbal scale that varies between 0 to 10. Non-verbally, which is usually in infants, you can use a flag scale. Nonverbal indicators of pain include increased heart rate and respiratory rate, as well as drawing up the legs of the chest, squirming, and pulling away when about to be touched.
Come in.
Are you having any pain today?
Yeah,
Where is it?
my shoulder.
If you could rate it on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt, what would you give it?
This is an example of the flag scale, so that when your patient is unable to verbalize their pain, you can use the different categories to score. Next is respirations.
I'm now going to check her respirations. The normal respiratory rate is between 12 and 20 breaths per minute. You want to watch for a full minute and note use of accessory muscles, shortness of breath, retractions, and asymmetry.
Like Abby said, when you're finding your patient's respiratory rate, you should note that the normal range is between 12 and 20 breaths per minute. You should watch respirations for a full minute to ensure that the breathing pattern is regular. Note the use of accessory muscles, shortness of breath, and retractions. Try not to let your patient know you're watching them, just to ensure that they do not change their breathing pattern.
Her respiratory rate was 18. That's perfect.
The next vital sign is oxygen saturation. The normal range is anywhere about 95%. You should place the monitor on the finger, earlobe, or on the foot for infants, and ensure that the nail is clean and unpolished so that the results are accurate. You should be concerned when oxygen levels drop to about 90% and below. Common interventions would be to implement the use of a nasal cannula. Hello, ma'am. I'm here to check your oxygen levels. So to start out, I'm going to put this on your finger. Now the proper placement is it needs to go over the nail bed and wrap it around. Now, because these are a handy-dandy 21st century, this is a wireless system. So normally there would be a cord that connects to your little pulse ox. Turn it on and you wait for the reading. So I'm turning on. High five! You're at 99%! Next is temperature. The common locations are oral, tympanic, axillary, and rectal. This can be measured in either Fahrenheit or Celsius. The normal oral temperature is 98.6 degrees Fahrenheit, which is 37 degrees Celsius. Axillary, you need to subtract 0.5 degrees Fahrenheit to 1 degree Fahrenheit, whereas with rectal and tympanic, you need to add 0.5 degrees Fahrenheit to 1 degree Fahrenheit for accuracy. The temperature app.
Ears, mouth, pits and butt, pits and butt. Ears, mouth, pits and butt, pits and butt. The mouth is preferred, but the pits are good too. Stay away from the butt. Use the butt. You might perforate a membrane.
Blood pressure. Hi, I'm here to take your blood pressure. Now before I take it, I just want to explain that it's hardly or rarely ever taken manually anymore. Now this is hooked up to a machine. So what I'm going to do is I'm going to find where it says artery and put it near her brachial artery, which is located right here. Wrap this around. Now cuffs can come in many different sizes. There's small, medium, and large. To find the correct placement of the cuff in between these two lines, it must wrap around and connect here, / fold. These things will be connected to the machine. You press on, turn on the machine, then you're going to press inflate, and as the cuff inflates, you patiently await, and it'll go beep beep, and it'll beep, and it'll tell me what your blood pressure is, and the normal range is 120/80, so anything that's relatively within that area is great. Also, check with your individual patient status and their previous history with blood pressures, like if they have hypo or hypertension, and see if it's within their normal limits, and if not, call a physician. Like we just said, the normal range is between 90/60 to 120/80. You should report any abnormal values. Note for hypotension and hypertension in the patient's records. Blood pressure is generally taken on the upper arm, however it can be taken on the forearm and calf. Be sure to compare bilaterally. The last vital sign is heart rate. You should listen to the apical heart rate for a full minute to make sure that there are no irregularities. You can time the apical with the radial pulse to make sure that they are in sync. You should note that the normal heart rate is in between 80 and 120 beats per minute. I'm now going to check our heart rate. In doing so, I listen to your apical pulse up for 1 minute. You usually listen under clothing or the gown. You can compare it from apical pulse to radial pulse. You can do that for 1 minute too. And then you record your findings. The average is between 80 and 120 beats per minute. That's all we have for now, but we hope you've enjoyed this presentation of